Hi all, my name is Dr. Carmen Brown and I am a board certified obstetrician and gynecologist. I am currently living and working in Melbourne, Australia. I am the founder and managing partner of ExpatMD, and I'm here to talk to you today about why ExpatMD could be the right solution for you. First of all, why? Why any of this, right? So I'm not here to try to convince you to move overseas. You have to want to do that yourself. Moving overseas is a huge endeavor and it's daunting, and it could change everything as far as the trajectory of your clinical career. However, for some of us, it is the absolute right choice for right now. I moved overseas back in 2010 when I was honestly very burnt out from medicine. As an obstetrician and gynecologist in the United States, as a lot of you all know, it could be fraught with like a lot of stress, a lot of strain, the hours, the calls, the malpractice. It's a lot. And so for me, knowing that I was relatively young in my career then, I knew I had a lot of years to go, and I truly do love my specialty. I love taking care of my moms and babies, but I knew I wasn't going to be able to continue at that rate for another 10, 15, or 20 years. So for myself and my family, we had to sit and think about exactly what we could do to preserve the things that we loved, which of course, spending time together as a family, but also our careers, and how could we morph that into the best way forward. And luckily, I found a locum in New Zealand, and I came to New Zealand, and that changed everything for me. And once again, I'm not here to try to convince you to move overseas. Once again, this is a very personal decision, but I can tell you for myself and my family, that was the best thing for me at that stage in my career. As an obstetrician and gynecologist in New Zealand, I found myself rejuvenated in the spirit of practice, medicine, and also having that connection again with my family and friends, and also finding outside things that I like to do that I didn't even realize before because I never had time to cultivate those interests. So for me, it was a huge benefit in that it just once again reinvigorated my ability to practice and be very happy in medicine. And so for me, over the last several years, several people have reached out to me asking exactly why we moved and how can they actually do that themselves. And so over the last almost 10 years now, I have helped several physicians make the transition overseas. And I believe that's basically the birth of ExpatMD. And I started this firm last year because after having this much experience with helping doctors in a variety of specialties actually make the transition overseas, I kind of decided that it was probably the right time to kind of put my hand up and help other doctors that are out there that might want to make that transition. There's a lot of misunderstandings about what it's like as a physician in Australia and New Zealand. And I believe that's why ExpatMD is so very critical in this space, is that we are for doctors and by doctors. And in that way, we're able to explain to you the nuances of your specialty when practicing in Australia or New Zealand and helping make that transition as successful as possible. How are we different from traditional locums companies? So I get that question a lot. A lot of people are like, well, can you just find me a job? And of course, I can help you find a job, but doesn't stop there. ExpatMD is unique in that, once again, we are American doctors and have a network of other American doctors that have successfully transitioned to Australia and New Zealand. And the reason why we're different from traditional locums companies is that, first of all, we're really focused on those physicians who are trying to make this a permanent solution. So yes, some people just want to do just a 1-year kind of taste and see exactly what it's like to move and work overseas. And that's totally fine. Happy to help there too. However, what we are really here for is those doctors who are like I was 10 years ago, completely fed up and wanting to make a transition that was going to find them in a way that they were going to be able to practice for a much longer time. And so we are actually here to help you gain that board certification and help you to actually get transitioned into the country so that you can actually make this your possibly forever home. How do we help? So I think the biggest thing and what I've had a lot of feedback on is our interview preparation. I think that's the biggest point of what a lot of physicians find that this has been very helpful. As a physician, at this stage in your career, you've probably done lots and lots of interviews. However, this is completely different. You're interviewing for a position in a different health service in a different country. And that's where we come in. Knowing that how American skills translate over, knowing how American medicine is, and what the expectation is in Australia and New Zealand can be really, really helpful. And we prepare you, not only helping you learn the demographics and understanding the health system in the area that you're interviewing, but also to help make you understand exactly how your specialty might be a bit different in Australia or New Zealand. And we've had a lot of wonderful feedback from clients that we've helped in the past. And so far, I am very happy to say that we have a 100% success rate on clients that have booked in with us as far as getting their job of their dreams in Australia or New Zealand. What else do we help with? So once again, moving overseas is a huge process. And another thing that we help with is actually the transition overseas. So for a lot of people, we're doing things like helping them find a rental home, helping them find appropriate childcare or schools in the area that they're moving to, and also helping them prepare for their board certification interviews, because that is going to be a huge part of course, helping you make that permanent transition. When to contact us? I would say you feel free to contact us whenever you'd want. For a lot of physicians, they might just want a little bit of information and just ask questions about what it's like living and working overseas. And we're happy to answer those questions too. At ExpatMD, we do a free 30-minute consultation with any physician who is interested in just kind of finding out what their specialty or what life could be like living overseas in Australia or New Zealand. And we're happy to help with that. Another thing I'd like to bring up is if you are still not quite sure and just want a little bit of information, I wrote a book called ExpatMD, Your Guide to Living and Working in Australia and New Zealand as a Physician, to help you kind of answer those questions if you're not quite ready. You can buy the book on Amazon, Barnes & Noble, or also on bookbaby.com. And I believe the book can answer all those questions that you just might have and that you might not be ready to ask. I'm very happy I made the transition overseas, but once again, this is a very personal decision. We're not here to try to push you into the idea, but to help you navigate and basically avoid the kind of pitfalls and really big bumps and hurdles that you might find if you were to go it alone. So if you are ready to make the transition, or if you're still just, maybe in the starting phases and just want to ask some questions, feel free to contact us for your free consultation. You can reach us at www.expatmd.com, and I hope to see you on this side of the world.